Hello, and welcome to part 2 of the community conversation on marginalized and underserved groups in Jamestown, broadcasting and streaming live from the Rev Charlotte Center for the Arts in Jamestown, New York. I'm Jason Stample, WRFA Station Manager. Tonight is the second of a 3-part panel conversation intended to raise public awareness on specific groups in Jamestown and the challenges they face, both past and present. It will also work to identify solutions to overcoming these challenges in order to bring more inclusiveness, diversity, equity, and accessibility in the community. Each panel discussion will feature representatives from 5 community groups, including the local AfricanAmerican community, the Hispanic community, the LGBTQ community, those affected by chemical dependency, and those impacted by generational poverty. Last week, we took an historical perspective on these groups, and tonight, our conversation will focus on the present state of each group, highlighting their contemporary challenges, hurdles, and obstacles. I'll remind our in-studio audience that they are welcome to write down questions and hand them out to our Director of Hospitality, Heather Felton. Meanwhile, our online audience, who's listening right now or watching, is welcome to write down questions in the comment field on both Facebook and YouTube, and I'll share them with our moderators. Please keep them brief and to the point. Our program is made possible thanks to an action grant from Humanities New York and funding from the Corporation for Public Broadcasting's American Rescue Plan Stabilization Grant. It's also presented by the Rev Charlotte Center for the Arts, the license holder of WRFA Radio, and also the Labyrinth Press Company, thanks to them in assisting with hospitality services. I'd also like to note that we hope this 3-week series of panel discussions serves as a springboard for other panel discussions next year in 2022, in which we will focus on other underserved and marginalized groups in our community not represented in this community conversation. Also worth noting that in addition to being broadcast on the WRFA airwaves, our program is also being video streamed by Kip Reynolds of Cranky Plate Productions on both YouTube and Facebook. Our audio engineer is Rev Charlotte Technical Director Owen Murphy. Now let's welcome our co-moderators for the event. Pardon me one second. Julia Cecila Hanley has been WRFA Public Affairs Director since April 2021, more recently employed as the City of Jamestown's Recreation Coordinator for 12 years. Ms. Cecila Hanley had previously served on WRFA's Community Advisory Board and as a volunteer since the station's inception in 2004. Amit Taneja serves as the inaugural Senior Vice President and Chief IDEA Officer, which stands for Inclusion, Diversity, Equity, and Accessibility at Chautauqua Institution. He started in this role in May 2021. He has over 2 decades of experience doing IDEA work in highlighting higher education, and most recently served as Associate Provost at the College of the Holy Cross in Worcester, Massachusetts. He has also worked at Hamilton College, Syracuse University, Bowling Green State University, and the University of British Columbia. And with that, thank you for attending, listening, or watching, and I'll hand it over to our moderators.
Thank you, Jason. Again, my name is Julia Cecila Hanley. I'm the Public Affairs Director for WRFA, and my pronouns are she, her, this is something we decided we need to do this week, as we did not do this last week. But this week, we are going to have our panelists talking to us about current issues faced by our marginalized and underserved communities. And again, if you are listening on our terrestrial airways at 107.9, you're quite welcome to also tune into our Facebook page, WRFA-LP, or our YouTube page, WRFA-LP or WRFA Radio, so you can watch online and submit questions online as well.
Hello again, I'm Amit Taneja. I use he, him pronouns. It's my pleasure and privilege to introduce our panelists for today's discussion. So we'll start with Reverend Charlotte Smith, who is a community activist representing the African-American community, and she uses she, her pronouns. Next to her is Mikhail Gilliam, who serves as the President of Pride and the Secretary of the Black Student Union at Jamestown Community College. She's a student there, and she's representing the LGBTQ community, and Mikhail uses she, her, and they, them pronouns. Millie Torres-Ruiz is a Jamestown resident, a parent, and teacher in the Panama Central School District, representing the Hispanic community. Sean Jones is a certified recovery peer advocate with the Mental Health Association in Chautauqua County, representing communities dealing with chemical dependency. He uses he/him pronouns. And last but not least, we have Terry Johnson, who works at the Resource Center. She is representing communities dealing with generational poverty, and she uses she/her pronouns.
Great. For our first question, which we will start with Pastor Charlotte, Reverend Charlotte, the question we want to ask is, what do you think is the biggest issue facing the African American community right now?
It was a challenge to pick just one, but I would definitely say it is poverty. And as we all know, Chautauqua County is known for having a high level of poverty. And as we move into Jamestown, it gets even higher. And there's so many negative outcomes that are attached to poverty. They include things like high unemployment. They also include things as homelessness or substandard housing for those in poverty, difficulties with nutrition and having enough food. So I would definitely say poverty is the biggest issue in our community. Even as I was growing up, I remember that I was in a neighborhood with the working poor, but the people in my neighborhood at least had manufacturing jobs, and those jobs allowed them to get their basic needs met. It was still a struggle, but they had their basic needs met, and now it is a struggle because so many manufacturing jobs are gone. For people to even get their basic needs met, even though they are working full-time, 40 hours a week. So I would say that poverty is the biggest issue in the Black community at this time.
Okay, thank you for that. Mikhail, so speaking for the LGBTQ plus community, what would you say is the biggest issue facing that community these days?
What I think about is just like communication. Checking on kids, because I'm 21, but there's so many young kids that are in the LGBTQ, and some of them are Black, and sometimes, for me, communicating about like anxiety, depression, it is hard to talk about it, because when we show or express our feelings, we think to ourselves, well, I think to myself that I'm showing weakness, and it's hard to really like talk about what's going on with my life, what is going on with like school, because I'm a college student and there's a lot of studying, working, and trying to communicate with everybody else. It's really hard, but checking on each other with mental health wise, and sometimes it's scared to talk to like your parents because you don't know if their reaction is going to be like, what's going on with you? And you try to express it, but they're not really like paying attention sometimes, and you be having like that self-doubt. But just checking on each other and just making sure that you communicate with each other, I think that's what's like important to me, because you need to check on people that really care for you and like support you no matter what.
Mm-hmm. Well, yeah. For Millie, for the Hispanic community, what would you say is the biggest issue facing them right now?
Diría que sería hablar, el idioma. Si no se entiende, ¿cómo sabemos qué está pasando? Si yo tengo un problema, si yo no puedo pagar para algo, si yo no tengo para comer, si yo me siento bien mal, ¿quién me entiende? So I would echo what she said in the respect of checking on one another, but we can't check on someone whom we don't understand by language. So I believe that the language is a barrier. And historically speaking, my family's been here since the 60s. And I feel like, I know that it was last week, it was history, but the dinosaurs aren't dying off. I just turned 50. And I have 2 beautiful daughters and my first grandson. And I carry a lot of grief, but I carry in my wiser years a lot more optimism, because although I was part of what Charlotte was saying about the poverty situation. We can compare our poverty all day long. It's relative. My ex-husband was from Ecuador, and all the time, oh, but we were so much poorer than you were. How do you describe being poor when you don't have anything to eat? You're hungry, you know? How do you get past the language barrier when your parents have to move you from Puerto Rico, from Mexico, and you can't speak for yourself? You can't help your parents. What do? You come to the school system here, you come to the social norms here, and I'll tell you something. In my few years here on earth, I've felt more welcomed in the Latino community, in the Black community, in the any other community than the white community at times. The other thing, okay, my sister was sending me little texts. Keep it light, I want to keep it light. My father, you know, he came here, he still has an accent, and he came here because my grandfather and uncle came after a terrible hurricane in Puerto Rico, and they lost all their crops. So they came first. Unfortunately, his mother passed, and he had found her at a young age. They were orphaned, the younger children, but he ended up going to Vietnam. So when he came to Jamestown, he had met my mother because she baked a cake for him because my Uncle Manny was here, and she saw this show. Well, he's in Vietnam. We've got to send this birthday cake to Vietnam, and it's got to get there by Halloween because that's my father's birthday. And in the end, he's like, I want to meet the woman who made this cake for me. So we kind of model also the famous couple, Lucy and Desi. And I say that because I can look at their family structure. My mother was very fair, although she was Italian, came from a huge family too. And so my father comes here, and and social norms for him was, I'm gonna have a pig roast in the front yard. He didn't know you couldn't do that. He didn't know you needed a permit. He didn't know you couldn't have a bonfire. He came from the mountains of Puerto Rico. You have people who are coming here today from those areas. And then my sister reminded me, she's like, remember, we had nothing. We had one another, and we had everything. And it's so true. We had nothing. I think about it today, and I'm like, oh my gosh, all this stuff. For what? Let's see here. But I think of the students coming here, and they don't ask for help, but it's not because they don't need help, they don't know what to ask for. They have no idea. And I don't feel it's our problem, meaning any immigrant who's come here, it's not our problem. And I am not an immigrant, I was born here, but the perception of the greater community, their acceptance, their inviting of us and working with us. And I think that's, if I answered concisely enough, I don't know, because I feel like it's, you know.
I think you hit a lot of different good points, though, of the challenges right now.
Yeah, definitely those.
So thank you, yes. For Sean, to talk about the biggest issues facing those dealing with chemical dependency now, I think we've heard of a lot in the news over recent years. So
I would say that the biggest issue facing the substance use community at this point is fentanyl. And that's not just heavy users, that's also just people who use on the weekends, casual users, you could say. Basically, all of the substances on the street right now are completely poisoned. Fentanyl has made its way into everything. So not just heroin, it's also in cocaine, methamphetamines. They're also finding traces of it on cannabis. So what happens with that is someone who thinks that they are just going to smoke a little cannabis can actually be smoking fentanyl and suffer an overdose or die from an overdose because they don't know what they're using and they don't know how to handle it. And the fentanyl is just coming in, it's unstoppable right now. And we're seeing just a huge backlash in the substance use community. They don't know what to do. We actually have people that come to us that use opiates and are okay with using opiates, but they want to stop simply because they can't find real opiates. All they can get is fentanyl. And they don't want to use that because they're just afraid of it. I mean, I think that is definitely the biggest issue when it comes to substance users, but also the stigma that's attached to people who use substances. You know, they're in the greater community. It's those people that do this. It's weak people. It's, all these different things. I don't like to use the words, so I'm not going to say them, of the names that people who use substances are called. But it's extremely degrading, and it affects all the communities, because people that use substances come from every single community. So, I mean, I would say that those are definitely the two biggest issues facing them right now, because it's hard to battle against your substances being poisoned when no one will give you respect enough to listen to you and to listen to your issues and your problems and the solutions that could be made to help prevent these things. So that's what I would say.
Wow. Thank you. Mm-hmm. Terry, speaking for the community that is in generational poverty, we've already heard this topic come up already. As we say, everything's intersectional. What would you say is the biggest issue facing those who have been raised in poverty and it's been a generational issue?
Sure. So there's so many barriers that people face on a regular basis, and some of the not easy to fix, but easy to recognize are things like transportation and affordable child care, homelessness and affordable housing, things like that. But we see people constantly having to either work 2 or 3 jobs just to pay for affordable child care, or quitting their job altogether because the amount that they would be paying in child care doesn't cover what they would make in a week. So being able to access the services and supports that can be available to help people in generational poverty, there's a lot of things out there, but navigating that system is very complex. And so I think our area is very rich in resources, but in order to be able to navigate them and be able to do it if you're working and having a low-income job where you can't cover all of your expenses, and you need to reach out for other supports and services to do that, there's a lot of challenges in being able to access those services and be able to navigate it on your own, because a lot of the agencies or organizations that you would need to go to are open your typical business hours, right? So they, if somebody doesn't have a job with flexibility where they can just run out, on their lunch break, or, run over to Department of Health and Human Services during their workday, they may not be able to submit their application for food stamps or, provide the paperwork to continue to get benefits. And so if they don't have a support system or somebody there navigating those resources with them and for them, they're gonna struggle. And sometimes the barriers get so overwhelming that it's easier to give up and quit instead of trying to figure out a way to continue. So I think that becomes a constant challenge and a struggle for people of wanting to break the cycle and get out of generational poverty, but then some of the things become so overwhelming and such a barrier that they often give up before being able to figure out how to manage it all.
Thank you.
So we've talked a little bit about the most pressing issues right now, but I'll invite any of the panelists to chime in a little bit around how do those connect to some of the historical barriers that have been there, like has poverty been always present for the African American community, for example, or the mental health issues that Michaela brought up? Have they changed? Have they evolved? Are the problems that we're seeing rooted in histories? Just any comments you'd like about that?
I think, with generational poverty, there's always been people living in poverty, but what we've learned is the gap between, working class, middle class, and working class and people in poverty has gotten a lot bigger, because you used to be able to work in a manufacturing job and be able to cover your expenses and pay the bills and have an entry-level job and still be able to feed your family. And now that takes 2 and 3 jobs, and having a 2-parent household with 2 incomes is not often enough at a lot of the jobs that we have in our area. So I think that gap between poverty and middle class is a lot larger than it used to be several years ago.
Thank you.
Well, I would say one of the things that historically kind of keeps happening with the substance use community is the stigma, and it can fade away and then it comes back heavy again. I mean, you know, and that goes all the way back to 1969 when heroin was flooding the United States during and right after the Vietnam War. When it was just on the streets of Harlem, and because New York City was really bad at that time with heroin, they didn't care too much. Once it started to reach white America, that's when President Nixon first declared the war on drugs because of who it was now affecting. Instead of the minority communities, it was entering the white community. And that's the same with the opiate crisis. Well, that's the same that happened with the crack epidemic in the 80s. When it was in the streets, they, you know, didn't pay much attention. It was those people do that, and those people need to go to jail. And then as soon as it started to reach white America again, they started to crack down on it and get more intense. And it's the same of what's happening right now with the opiate epidemic, and the same with the fentanyl coming in. Because it's reached white America, they're starting to want to do something about it. You know, the one thing that, you know, they're always saying it's these people that use it or those people that use it, but just 3 years ago, the average opiate user in Chautauqua County, and especially in Jamestown, New York, was a 27-year-old white female. That was the average user. So it's, you know, the stigma that is attached with drugs or substances is something that just keeps rolling over and rolling over and rolling over, and they kind of start to nip it a little bit and, you know, try to help fix things, but then they just let it fall back off again once it leaves the white community.
Thank you.
With the Latino community, I think it's just historically it's still here. And when you talk about the generational poverty and getting help and navigating, on top of navigating, they usually bring their children to do the translation, and or get people who are paid less than what an interpreter should be paid for within the job themselves, and, you know, expect and almost, I would say, give fear that, you know, if you don't interpret for whatever we need, then, you know, your job's on the line. It's difficult, time consuming. But what do you do? So.
For mental health, it changed, but it's just that trying to reach out to people that want that help, because it's hard, especially for me. I know I was in high school, and that was like 5 years ago, eons. Oh. And trying to talk about my mental health with like my family, because I lost my mom and my dad when I was very young. But trying to talk to my aunt about it, it was difficult, because when I talk about depression, she always say, "Do you want to go to the crazy house?" And it's like I shut down after that, because it's like I can't really talk to her. Like the communication was so messed up, and then the family that I have in that was really like, "Oh, suck it up, you know, you're strong, just suck it up." You know, it's just like, sometimes I'm not. Like, sometimes I really want to talk about it. Even if it's good, bad, weird, I just want to talk to y'all guys about it, you know? But has it changed? It did, but it's just trying to reach out to people that need that help. And it's hard to really get myself out of that, like, phase of, like, being in a dark room and no one's paying attention to me or something like that. And someone come up there and say, I'm supporting you, you are not alone, I need your support. Like, you know, just reaching out to people that needs help. It's changing. It's taking baby steps.
Thank you.
And looking back, it feels as though the Black community is somewhat stunted, because even if you look back to the 1960s, there were Black teachers. Even when you look back to the 1960s, there were Black nurses at WCA. There were Black women who were elevator workers. It seems as though there were more opportunities looking back than right now. And I find that very disturbing. And I'm looking as to why our opportunities seem to be becoming less and less, so much so that people are just leaving, and they're to go forward to other opportunities. And the wealth and the richness of the Black community is going to other places and thriving, and I want them to have the ability to thrive right here in Jamestown, New York, and Chautauqua County.
Yeah. We've talked about challenges and biggest issues, but I think, we also want to celebrate these communities that we have here on this panel today. So, starting with Reverend Charlotte, what would you say are the greatest strengths of the African American community?
Now you're trying to get me excited.
Oh, yes.
Let that pastor come out.
Yes. I do so appreciate our entrepreneurial spirit. We are the type of people who know how to make $1 out of 15 cents.
Preach.
In the midst of COVID-19, there was a Black beauty shop that has opened. I'm so appreciative of the community who are pursuing the Black businesses that have upstarted. There's businesses that are doing landscaping. Even in looking back, as I look at my grandfather on 12th Street, he had his own detailing shop, and now his grandson is doing that same detailing. So we have such an entrepreneurial spirit, and Black women in particular are 3 times more likely to start businesses than any other ethnic group. So I appreciate that, but I have to reach back and talk about the faith of the Black community, because that is the thing that sustains us and gives us hope when things seem so hopeless. I think about North Main Street Church of God and the men and the women who built it with their own hands, with their own sweat and tears, who mortgaged their tiny houses to build it up, and it's still going today. So it is the faith that helps us to persevere. It's the faith that helps us to be a people that is resilient. So those are the things that I appreciate most about the Black community.
Thank you. Mikhail, for the LGBTQ plus community, what would you say some of the greatest strengths are right now for you guys?
Right now, I don't know if June, we had our first Pride Club in Jamestown, but that was amazing, okay? I saw my favorite drag queen there, and she was awesome. And I just love it because we all come together to do one thing, is support each other. Me as a pansexual, it was hard to come out to anybody, and trying to figure out who I am and trying to be with people that support me about that is awesome. I love us. We are awesome. We are great. I just love us coming together for Pride Club, celebrating so many years that we've been fighting for our rights to do what we want to do and be who we really are, and loving each other no matter what. So that's what I'm really happy for.
Great. Millie, for the Hispanic community, what would you say greatest strengths?
For the Hispanic, Latino, talk about pronouns. There's so many things, so many names for anybody who's Latino and Hispanic, and the vibrant family bonds, the social gatherings, the support that, even though sometimes it can be, I guess, limited depending on who's left in the family. I remember feeling blessed that on my mother's side, she was an only child, but came from, her father's family was of 18. And on my father's side, 10, but they were in Puerto Rico, but hearing the language, celebrating with the music, the food, oh my goodness, the food. And then through the years in the community here, just the different people who would, just do different things. I still remember a couple. It was one of my father's friends, and this was back, I want to say in the early 80s, and they actually created what was called the bohillo, which were the little huts that were familiar back, I guess I want to say when the Taínos were there, which if you know your history, they were decimated, but bringing the culture back and celebrating with these things that are just true to life, bigger than life, and the spirit of our communities. Oh my gosh, and it doesn't matter if you're Puerto Riqueño, Dominicano, Cubano, lo que sea, whomever, it's just, it's a vibrancy, life.
Yes, indeed. Sean, for substance And chemical dependency, it seems like maybe an odd question. What are the strengths of the community?
Oh, it's not an odd question. The strengths of the substance use community is the peer movement. I mean, it is getting stronger and stronger constantly. So the peer movement is like where I work at the MHA, all of us who work there are peers. So like myself, I am almost 7 years, well, a little over 6 years, almost 7 years sober from alcohol and cocaine. And I say that freely with no embarrassment whatsoever. And that's what peers do, and that's what's exciting for us is we are out there, we are helping people exactly like us to achieve their goals. We're meeting them where they're at. We're not telling them that they have to do any one thing or the other. We're helping them achieve their goals with whatever they are. And so the people in the substance use community are becoming more successful through that. You know, in the past, they've always just been told you have to quit and go to rehab, and that's all it is. That's not what we do. We use harm reduction in the peer movement. So that's, like I said, meeting them where they're at, focusing on their goals, whether it's, you know, some people it is abstinence from substances. Some people it's learning how to use it smarter, you know, learning how to maybe cut down a little bit. And it's just an exciting movement, and especially here in Jamestown, New York, you wouldn't think about this, but I mean, our peer movement here is amazing and stronger than a lot of bigger communities. I mean, a perfect example is when I first started working at the MHA, the grant that I was hired for, I had to go to a couple different places and speak. One of the places I had to go to for a meeting was the Bronx. Now, you would think that the Bronx would have an amazing peer movement. The place I went to, and I was telling them, you know, well, I work at the MHA, all of us are peers, we have over 20 different, you know, recovery groups, you know, anything from meditation to traditional AA to knitting to painting to this, and they're just looking at me going, what are you talking about? Where is this place? You know, this must be amazing. And it's like, well, we're in Jamestown, New York. You know, but I mean, but it just shows that, you know, the dedication that the substance use community has here to each other, no matter where we're at. It's a very strong community, and we're pushing that movement forward leaps and bounds. I mean, just in the 3 years that I've worked there, we are now, you know, working very closely with a lot of different agencies, but especially with like the hospital, UPMC. When I first started there, you know, peers would go into the emergency room, but we weren't necessarily listened to. Now we're getting ready to set up our own office within the emergency department to be there and to be a part of the care of someone who comes in with either a substance use issue or a mental health issue, working side by side with the nurses and the doctors and everyone else to make sure that the people that come in get the best care. And that's from us pushing the movement forward, not just slightly talking about it. We're there, we're talking about it, we're here, and there's no reason for you to do anything. You know, it's nothing for us without us. And a lot of communities say that, but that's really important in the peer community, because if you've never used substances, if you've never been addicted to a substance, you have no idea how to treat that. So that's why it's good for us to be there, to be that voice of understanding and that voice for the people who don't have a voice when they enter certain situations. So it is exciting.
That is exciting. Wow. For Terry, for those living in generational poverty, what are the strengths of the community despite the challenges they have?
So there's a lot happening right now, particularly in Jamestown. A few years ago, the city of Jamestown was awarded money for an Empire State Poverty Reduction Initiative. And that opened up a lot of opportunities for different providers to come together to support people in poverty. And that has been a really exciting opportunity that Jamestown had that a lot of other communities don't have. And it created a lot of collaboration and partnerships amongst the organizations working together. I think that was an area where not only could the partners that are providing supports to people in poverty could come together, but they could work with a person and really collaborate with another agency. So if I was supporting somebody and through the program that I had, I would say, you know what, I really think that you're going to benefit from the Mental Health Association and their program, and give them a call and do a warm handoff and communicate back and forth. And all of the different providers that were providing those Osprey programs worked together, and we met once a month and had an understanding of how we could help each other. So there was those 7 organizations, but then there was a lot of outside organizations that we could partner with too. And I had mentioned in one of the previous questions that there's a lot of services and supports that are available for people, but accessing them can be difficult. And I think there is a lot of hope, with a grant like that, to be able to help somebody navigate through those difficult scenarios and trying to figure all of that out. If there's funding available, which there was through that program, we can help people kind of figure out those systems and how to navigate all of the different resources that they have. And then working with other businesses. I think our business community has gotten a lot better of trying to understand people in poverty and where they're coming from and some of the challenges that they face. And there's been more of an interest in employers trying to understand their workforce. We know that the workforce isn't the same that it was 15, 20 years ago, and there's not a long line of people knocking down all of the doors to take some of our positions. So employers are starting to understand and realize that, I may have fired somebody a couple of years ago because they were late to work a lot, and now I'm going to ask why and figure out, it's because their child care situation is strained, or their vehicle broke down, or really trying to understand the reasons why somebody may have been late to work before just, you're at your points, you're going to be terminated. And I think that's really exciting to know that the businesses are really starting to embrace that and understand that they need to make an investment in their employees and their workforce, and know that their employees are coming to them with some challenges, and they're taking the time to care and learn more about their workforce needs. So I think that's really exciting. And there's a lot of businesses that are really going above and beyond to help their employees, or businesses that are really making a stretch to help people in poverty by, there's some financial institutions that come to mind that will go above and beyond to work with people in poverty to help them build their credit and give them opportunities when nobody else will, because of things that they've done in the past, and recognizing that, there could be situational things that have gotten people where they're at, but there's always a way out when it comes to financial issues, and willing to listen and work with them to figure that out. And then I would say local, for Jamestown, the United Way of Southern Chautauqua County has really been spearheading a lot of those things, specifically with Osprey, but really forcing some of those organizations to come together and collaborate. And I think having those agencies come together and work together is really making us be able to provide those supports to people in a much stronger and cohesive way, instead of in our silos that we may have operated in before.
Great.
Well, so far this has been my most favorite part of the conversation, because often we talk about the struggle and challenges, and those are very important, but in that we forget the strengths and the moments of celebration. So thank you all for that. Just a quick reminder for our audience members who are present in the studio and those watching online that you're welcome to submit questions anytime online, as can the members of our studio audience, by just raising your hand. So we'll shift our focus a little bit to some of the most pressing challenges that we've been facing as a country, as a globe, having to do with COVID-19. So we're curious to hear your thoughts about how COVID-19 has impacted some of the challenges that you mentioned, or maybe challenges that you haven't mentioned. What lessons can be learned from that impact? But yeah, really, let's bring us back. And I think a lot of us are ready to move past COVID-19, even though it may not be past us yet. But I think it's important to focus in this moment, reflecting on the additional challenges that were maybe highlighted. They may have already existed, but maybe are highlighted even more by COVID-19. Why don't we do it in a different order, so we don't always put Reverend Schlo on the first on the docket? So, Sean, maybe we'll start with you. Is that okay? I'm just randomly going to pick.
No, that's fine. Yeah, no, that's fine. So COVID affected the substance use community pretty hard right off the bat. The opposite of addiction is community. As soon as things were shut down and forced to shut down, that's really hard for especially the recovery community, we rely on being able to get together, be able to support each other, go to meetings, talk to people in, face to face. When we're isolated in our apartments or wherever it is we live, by ourselves, that gives us a lot of opportunity for relapse if we are abstinent from substances. But also too, it's just, even if you use a little bit, you can start to ramp it up even more because you're completely isolated. A perfect example is there was a lot of people that I ended up working with when COVID was kind of letting up a little bit, that they were guys and women of all walks of life that were the type of people who came home from work and had a beer or two. Well, now they're not working. They can start drinking first thing in the morning. Because, you know what I mean? They have that opportunity. So that isolation is what caused their substance use to really ramp up and really, hit them a lot harder. But one of the things at the MHA that we did is we didn't stop. We kept moving forward. We knew that our community needed us to be there. The whole staff wasn't made to work. We were given the opportunity. If you want to work from home, you can. If you want to be here in the office, you can. These are going to be the rules. But literally the very first day that the country was closed down, as soon as we were done talking about it in our staff meeting, the phone rang and we were asked to come over to the emergency room to see someone. And we didn't skip a beat. We walked right over there because we knew that this person needed us, and we couldn't not go there, And we continued that throughout COVID to be able to do things like help Salvation Army and the food pantry deliver food to people. So people within our community, we would go and pick up food and bring it to their houses and drop it off. So participants of the MHA that we knew that couldn't get out and about, we would bring them food. We would bring people who use substances, especially opiates and others, Narcan, so that they had that. They had the ability to have the Narcan on them in their house. If they needed training, we would train them. We were just trying to bring all of our services to their front door. The same with Zoom meetings. We quickly put together a new schedule of our meetings to be able to do them on Zoom and try to support people that way. COVID hit us hard, but we were able, I feel, to really adjust to it quickly, to make sure that no one was left behind during that time. And I think, honestly, it had for the negative effect that COVID had on the world and this community as a whole, I think we actually had a very positive outcome with our community because we were able to still support them through that. So it's kind of a mixed bag for us, I think.
As you were talking, it was really reminded me of the comments that Mikhail made in the beginning, the need for people to be present, to be able to listen, to be able to show up, and it sounds like that the Mental Health Association really stepped up to that challenge to be present. So with that, actually, why don't we go to you?
Oh man, I remember the first time when it hit us last year, and it was still my freshman year of college, and I was literally in English, and we was just getting an essay done, and everybody was looking on their phone saying oh, there's this COVID situation going on. And I'm like, what do you mean? And I'm looking, and they said that we should leave school immediately, go home, and quarantine. And I'm like, okay. But then I start thinking about there's a lot of kids that doesn't really have a home to go to. There's a lot of kids that live 5 hours away from Jamestown, and they have to get everything sorted out and trying to leave from this Pacific day, and it's it was hard from that day. Oh gosh, man, COVID really hit so many students, and staying at home, trying to quarantine, staying at home with a lot of families. Sometimes you need to take a break from your family. I ain't gonna hold, I just wanna go outside. You can't go outside, you gotta stay in your room. I don't wanna stay in my room, I wanna go outside, And it was hard, but now that everything's together for Jamestown, college, we're making it mandatory for kids to take the shot. And if they don't wanna take it, it's fine, but they'll be online. So they have an option to do that. But But when it comes to kids that doesn't have a home, they can stay during the break and just make sure that they have enough food. We have a food pantry there. We have a shuttle bus that come every other Wednesday. We have a lot of opportunities for kids. So we do not want them to be stranded. We do not want them to be hungry. We want them to be cared like we're their basic family. So that's what we've been working on. COVID did hit us hard, but we worked on to make sure our students is okay to live in the dorms.
Thank you. Yeah, it certainly reminded me, since I most recently came from a college, particularly for some of our LGBTQ students who did not have very supportive families, to go back into an environment where either you're not out or your family's not as accepting. Actually, a couple of them did end up being homeless, so we had to work really hard to kind of figure out some stable housing for them so they could continue their education. So in both of these instances, I'm seeing a thread, right? While there were challenges, again, going back to the strengths of the communities, the ways in which we can organize to support the most vulnerable is really laudable. So thank you for that. Why don't we go to Millie next?
I don't know. I mean, I don't know that I can speak to it directly because of where I'm at now in my life, but perhaps educators in Jamestown would know. I kind of feel like they might have been more silenced, even more so with the language barrier, and then just not having perhaps internet, phone ability. I mean, they're already with the poverty. And I don't know how that worked. You know, I don't know if it, in some cases, it could have been easier because you did have the Zooms. I don't know how that worked. I hope it was better for most, but I can't speak to that.
Great. Why don't we go to you next?
So, you know, I think that it really leveled the playing field a little bit because there were people that had not been in poverty in the past that suddenly found themselves in situations and needing to seek help that never had before. So I think in that regard, it really leveled that playing field for people. Also, I think people that live in poverty are used to having to live with the unknown and not knowing what's coming tomorrow. So it wasn't as much of a, you know, shell shock for them because they always are trying to just get to tomorrow, right? And not knowing what they're going to be doing next week or how they're going to get there, or if they're going to be working or not working. So in that regard, I think it didn't have as much of an impact as it did maybe on other people that are not in poverty. But one of the biggest challenges really came to, again, childcare. When your kids are not going to school every day, and I know many, many kids last year were either every other day or half days or a half day every other day. How does a parent go to work, right? So if they're required to go to work and they have a job where they were considered an essential worker and their business was operational and they couldn't go and they didn't have the flexibility to work from home, that definitely had a huge impact on people because if you quit, you weren't going to be getting that unemployment that people were getting. If your second or third job that you have was closed, you know, you might have your full-time job at 40 hours a week, but your second job, you know, at a restaurant is shut down. So you don't have the income, but you're not going to be able to collect unemployment because you're still working a 40-hour-a-week job. So that extra income that you're used to getting disappears. And you're not going to be able to get that extra financial support. That was definitely an impact for a lot of people that I don't think people realize because they're like, well, if they lost their job, they were collecting unemployment and they were getting that extra unemployment. Many, many cases, that was not how it was working for people. So I think although they were able to adapt maybe easier than others, it definitely created some issues with that ability to take care for your family if your kids weren't in school. So that, I think that was probably what we saw the most, is that barrier with kids in school.
Thank you. And last but not least, Reverend Schlo.
Yeah, from my perspective, it exacerbated issues that were already in the Black community. So people that were already living hand to mouth, suddenly their financials were pinched even a little more so. But what had to take place is we had to mobilize as a community. A good example is North Main Street Church of God, who opened up their church to students so that they could have internet access and so that they could get help and not fall behind in their work. It was fascinating to me to be in certain circles in which that were non-Black, and the people were talking about what they were going to do with their stimulus, and where they were going to donate their stimulus, or how they were going to invest their stimulus. Yet the people that I knew were waiting on that stimulus to get to be caught up on their bills, to be caught up on their mortgage, to have food and their basic needs met. But I'm so grateful for the churches, in particular Healing Word, who got through the federal government boxes of food that they were able to distribute monthly. That was very helpful. But as a community, we had to mobilize and help people get through financially, help people to pay their rent, help people to meet their mortgage. We had to come together and help one another and be there for one another. And I don't think many of us would have navigated it as successfully if we did not have each other as a community.
Yeah. When we think about a pandemic, large challenge, large current event that's still ongoing, but we know there are other things that have been going on over the last recent years, especially in the last year. How would, and I'm going to start with Michaela for this one. So how would you feel that any of the local, state, or federal policies, how have they challenged positively or negatively the LGBTQ plus community?
Let's see. They have challenges a little bit. I know, like in the beginning of this year, it was hard for us trying to get everything together and communicate because of COVID. It's just like, we're trying, like we're trying our best to get everything together. And so many trans lives have been lost in this year and year before that, trying to get the rights that they need. I know that we wanted people to see that we are human as well. Trans, dems, pans, lesbians, gay, we are getting the rights like everybody else is when they're straight, And it's hard trying to fight for that for so many years. And people are still putting it under the rug and acting like it's no issue. It is an issue. You see it. Support it. And then some people say, like, I support it 100%. Are you? Why are you not standing beside me? Why are you not giving the energy I'm giving? Because it looked like you're saying it, but you're not doing the actions. But we are getting ourselves out there to show that we are still fighting for what is right, and people is going to recognize that if we have to shove it in their face, which we're not that violent, but we can get violent if you want, it's like that. But yeah, we're trying to make a change, and people need to see that. It's not always the same. Everything change all the time. So people need to recognize that change is a good thing.
Okay. I'm going to switch over to the other side of the room. I'm going to come back to Terry first on this side. And how would you say what you've seen from local governments, either policies, how is it affecting those living in generational poverty right now?
I'm so glad you asked that question. So many people aren't aware of what's called the benefits cliff. And that has a huge impact. The benefits cliff negatively impacts people who are trying to work and get out of poverty. And so oftentimes people's benefits that they receive have more value than the money that they're earning. So they will be penalized if they would get more hours at their job, or if they get a 25-cent raise, they're going to lose some of the subsidies that they earn, whether it's child care credits, housing credits, food stamps. So those benefits go down as they make more money. So the way that it works is, somebody would get a 50-cent raise, for example, and they're going to lose their food stamps and their housing subsidy. That is far more valuable than what they're going to earn in that 25-cent raise. So people then are disincentivized to make more money, work more hours. And so you hear employers constantly, saying, I don't understand. I offered them more hours. I offered them a pay raise. Why would they turn it down? And that goes back to, businesses not always understanding their workforce and needing to kind of understand, and what Sean was saying, meet people where they're at, because they don't understand the barriers that somebody has in trying to get off of getting some of those assistance. People have to make really difficult decisions on if they're going to work 2 jobs, if they're going to take a full-time job, because that full-time job could eliminate, they might make, $25,000 in that full-time job, but they're going to lose $30,000 in benefits by making a $25,000 job. So that benefits cliff is a huge impact, and there's a lot of policy issues that are related to that, but people really do get disincentivized to get out of that position. So it really creates a barrier for why people get stuck in that position. So people make those decisions to not work or not take those pay raises. And then some of the subsidies, that childcare subsidies, for example, can fluctuate based on your hours. So if you have a job where you might work 25 hours this week and 35 hours that week, your subsidy is going to vary. And then it's hard to find reliable childcare, from week to week, and have something sustainable so that you can continue to go to work. So there's a lot of barriers there with some of those public assistance and supports that people can get that really interfere with them being able to get out of poverty, and why we see people, generation after generation staying there, because it's sometimes easier. Because it's hard, if you're not making a drastic change in your salary and you're doing it in small increments a little bit at a time, you're never going to get there, because those benefits, you're going to go a long period of time with less income by working than you would by being on public assistance.
Really interesting. I'd gone to the task force report and heard about this benefits cliff for the first time, and really, I think the average person doesn't understand how difficult it is.
It's very complicated, and it's one of those areas that I hope people will learn more about and take the time to research it, because there's certainly a lot of opportunities to rearrange systems and perhaps incentivize people for working and being able to, take those extra hours or earn more money and kind of reverse the way that it works currently.
All right. I'll apologize to our camera folks. We're going to bounce back over to the other side, to Reverend Charlotte. And what have you seen happen within the African American community, either positive or negatively, in terms of policies that have come forward from federal government or state government, or even local here in Jamestown?
Yes, and I would have to take it to locally, because anyone who knows me knows I'm grassroots. And I have to go back to the summer of 2020, where we had a series of protests to stand against racism, to stand against injustice. And as a result of that, and I hope all of you under the sound of my voice understand that there is now a movement taking place. There is now a certain thrust and momentum within our community that is happening at the grassroots level. And people wanting to affect change in their sphere of influence. And what I am pleased to see is that people from every sector, businesses, the nonprofit organizations, education, I can go on and on, they are now beginning to collaborate and look at things through the lens of equity, and beginning to collaborate to see how we can affect change positively as a community. Because although I'm pleased at the momentum, I'm pleased about the grassroots level, if we don't take it to the policy level and begin to affect change at that level, nothing is really gonna change. So I'm pleased that there's organizations like the United Way, there's organizations like the Community Foundations, there's organizations that like the YWCA, that have such strong leadership and that are moving the dial forward on these important issues. Just an elephant in the room, I have to say this, that by 2044, the United States is going to be predominantly people of color. So if we don't, at this time, begin to address the problems that stem from racism, that stem from discrimination, these structural issues that are within our systems, we are going to be in trouble as a country. Even if you look at Chautauqua County, Jamestown, New York, 9% Hispanic, 4.7% Black, and it just continues to increase. So the diversity is here. And if we don't begin to address those issues now as a country, babies born 2012 and upwards to today, most of the babies born are babies of color. So if we don't begin to pull up and lift up the boat for people of color as a country, we are going to be in a lot of trouble.
Very powerfully said, yes. Millie, I would like to go to you next and talk about, Reverend Charlotte mentioned it was 9% of Hispanic, is the Hispanic population right now in Jamestown, and that is it's a lot larger, I remember, from even the last census. And so have you seen with policies, whether it's from government or from education, whatever it may be, that are affecting the Hispanic community with the challenges they have?
I guess looking to the youth, and it was when my daughter, my youngest daughter, who's 19 now, she, just as she was after she was born, I was a paraprofessional at the high school. And what I saw, and again, language barrier, with all the greatest intentions in the world, these kids are trying to learn, but especially the older ones that have come from wherever, to jump into the education and be at the level maybe that they were at home, or just to, and I really can't stand this phrase, but pull themselves up by their bootstraps. There's no bootstraps. There's nothing. To watch them fail first, highly academic, where they came from, but have to fail because there's not an adequate bridge of support. When we talk about resources in the community, the people, and I guess this is age old, I don't know, the people who have deep pockets, they get deeper. How are we sharing those resources? How are we really looking at the situation? And I have to say, going back, I'm super honored to be here. I don't know who thought of me, but super honored, because through the years that I've lived, I've tried to advocate for the Latino community. We need leaders. I can't say that I would be a leader because I don't have color. But I would go to being multiracial, multi-ethnic. I'm bilingual. I want to give back to the community. I still say that, by the time I'm able to retire, maybe 72, at 75, I'll probably be placed in jail for my student debt. So maybe I'll do piecemeal work. I don't know. But where are the supports, the foundations? How they sparkle. And I'm not trying to be ungrateful. We need to do more. Yeah.
Thank you. Sean, for what you're seeing at the federal level, and I think that also at the state level, especially when it comes to chemical dependency, how are those policies that have been coming out and even at the county level affecting those living with chemical dependency?
Well, I think first and foremost, one of the things that needs to change right off the bat, and this doesn't just affect the substance use community, but it does affect all communities, is the schedule class drugs at the federal level. So, and a lot of those laws were put into place to put minorities into jail for having small amounts of marijuana, small amounts of heroin, cocaine, whatever it was. They were put into these different classes. I mean, cannabis is still considered a Schedule I drug right next to heroin. That's not because they are the same substance, they're not even close to being the same substance, but because those were the two most prevalent substances within the inner city and within the ghettos at the time that they made these laws. So this was a way to get people into jail, period. Those need to change. They need to change because it's just, it's nonsense. I mean, it really, truly is. I can understand having certain laws for people who are dealing mass amounts of substances that are illegal, but for the average street user, there's no reason for them to, the third time they get caught with personal use of heroin, go away to a prison for 10 years or whatever it is. That's ridiculous. So I mean, at the federal level, I would say that is something that needs to start changing. And I mean, me personally, I'm not speaking for the MHA saying this, but me personally, cannabis needs to be legalized across the entire United States. It just does. There's no reason for it not to be. I mean, we're lucky here in New York State that it has now become legalized. But I mean, in other places, there's still young kids that are literally smoking a joint and going to jail. And that is just, in my mind, that's ridiculous, and that needs to change. So that, I mean, at the state level, and it goes to the federal, but I will agree with the benefits, Cliff. I mean, we've talked about this a lot. Those are laws that really affect people with substance use. Because the thing is, so someone's trying to get back on their feet. They just get out of rehab. They do not have a job. They're not necessarily looking to get a job right then and there, but now they are loaded up with all these appointments, medical appointments, counselor appointments, doctor's appointments, and you throw on top of that all the appointments at the different agencies, that they have to go to just to get a very small apartment, and you miss one appointment, now all of a sudden you're shut off from this, it's ridiculous. And so same kind of thing is they get to a point, why did I do any of this? Why did I try to improve my life if all that's going to happen is I'm going to be shunned and, penalized for, I was at my doctor's office, I'm sorry I couldn't walk over to DSS fast enough for you. You know what I mean? And then they're losing benefits. I mean, that's horrible. I mean, locally, I don't know, it's hard to kind of really say. I mean, there's things that are starting to kind of move in different ways. I mean, we're lucky enough to soon we will have a methadone clinic up in Dunkirk, which is great, but same thing, that goes to a federal level. There should be methadone clinics everywhere. But same thing, methadone is right up there. Well, actually, I think it's one below. I think that's a Schedule II, so that's even lower than marijuana. But it still has so much federal regulations to it that it is ridiculously hard to get a clinic to give people medicine. It's medicine, and it is the most studied medicine, period. No other medicine has been studied more than methadone. Not even penicillin, so it works, it's approved, but because of the people who use it, it has all these federal regulations. And then last but not least, the one thing I just want to say, and I'm sure the Facebook page will blow up on this, but I love that they have the bail reform. I absolutely love that they changed those, because a lot of our people in the substance use community were going to jail for doing something like stealing food. It's not that they were committing a horrible crime. They were hungry, because same thing, the benefits cliff, something didn't work out, they no longer had their stamps, they're homeless, they're walking the streets, and they want to go just get some food for the night. And then they go to jail because they stole food. So now with bail reform, they don't have to go to jail. They get the ticket, they report to the courts, you know what I mean? And they can go through the process. So, I mean, there's small little things that are happening, the same with, possessing, needles. They're not getting charged for these things like they were before. They're not going to jail for these things. So that's maybe a little bright spot, I can say.
Just for one moment, we're going to pause to do a station ID. You are listening to 107.9 FM, WRFA in Jamestown, New York. And also, I think this would probably be a good time. We have at least one more question or two. Is there any questions from in the audience that? I do have. All right. Great. All right. Thank you, Heather. Okay. Do you want to ask the next question, and I'll look this over?
While you look this over. All right, great. I know that we've talked about some of the challenges, but we have not talked about all the challenges, and I'm hopeful that some of our audience members, either in person or online, would be interested in getting to know more about the issues and challenges facing all the different communities represented here, and also how they might be able to assist in those efforts. Part of the goal of this series is to educate, but it's also to move people to feel that sense of community, that kind of call that Reverend Schlo put out for us to rise to the moment and the challenge. So the question really is about how can people learn more about the issues and challenges facing your communities, and how might they assist you in those efforts? And I'm trying to now remember who has not gone first, and I think Mikhail hasn't, so we will go to them first. So how can people learn more about the LGBTQ plus community, and how might they be helpful, how might they assist?
To learn more is to search, to get to know people that is in the LGBTQ, and you don't have to be gay to be part of it. You can be an ally. We need allies. There is so many things that we can do, but we need more support to do that. So do your research, come and join, come sign up. I know I'm at school, I am the president of Pride Club, so I'm getting so many kids on campus and off campus that wants to come and do events and speakers that can talk about LGBTQ. So if you do want to be an ally, you do want to be a part of this, come and join. We are literally looking for help, so yeah.
Terry, why don't we go to you next? Again, thinking about how can people learn more and how can they be of help?
I would, again, echo what you have to say. Always just do your research and be amicable and open to meeting new people. And going back to the language, I just have to say, en español, que cuando yo quiero, yo hablo en español, con quien sea, cuando sea y donde sea, porque yo sé otro idioma. So I say this, and what I said was that I will speak Spanish with whom I want, when I want, where I want, because I can. And I'm not talking about you. I don't have the time in my schedule to talk about you and you and you and you and whoever you are. We're not talking about you. And it makes me upset. It really does. We're not talking about you. We're having conversations about everything you're having a conversation with. The difference is you whisper in someone's ear in front of the other person when you're slighting them. You're slighting them in their faces. So unfortunately, racism is alive and well. And I guess going back to the other question, it was hard for me to, I guess, say this and what Sean, you were saying, blowing up on Facebook or whatever other media, or the regular old grapevine, the anti-immigrant sentiment is alive and well. And I think it was Justin from the JJC from last week, and he made mention that wear red or an orange today to remember those Native Americans who are also not represented here today because of time and, as you said, going forward, but who were adopted out to assimilate them. And it's just not okay. Honestly, I'm really getting a terrible headache right now, and I don't know if it's the lights or the weight of what I'm feeling. I feel it's horrible because I want to be optimistic. I do, but it's hard. So I can't imagine what other people are feeling again, in the face of poverty, in the face of being refused because of who we are. Why? And then people will tell me, oh, there's no reverse racism. The hell there isn't. When I went to college, because I was speaking with my friends, I just really mastered Spanish. So I feel that I'm near native. I don't feel that I'm completely native speaker. And I was told I was a sellout because I was talking with, my friend was told she was a sellout because she was talking with me, the white girl. So how do I classify myself? You know, I didn't ask to be born like this. I love who I am. I've learned to love who I am. Why do we have to explain ourselves? I don't understand.
Thank you for being vulnerable, and thank you for sharing your truth. This came up last week as well, as we may have invited you to speak on behalf of a label or community, but even within those communities is really lots and lots of different communities that make up, the collective experience.
Yes.
So thank you for speaking your truth, and thank you for hanging with us. Yeah, I feel that heaviness too.
Yeah.
Why don't I'll be kind to our camera folks, and we'll stay on that side of the room and go to Reverend Schlow next. So again, the question being around how can members of the greater Jamestown area learn more about the issues and challenges facing the African American and Black communities here, and how can they assist you in those efforts?
And there are so many resources out there, how to be books and YouTube videos, showing people how they can be an ally, showing people how they can not only not be racist, but be anti-racist. And I appreciate my friends that are making the effort to read, to find resources so that they can better understand me. But if anyone knows me, to me, it is so relational. And I would ask that you be intentional about coming into the space of Black people. Do you know how many times that I've had to be the only Black person in the room? Are you willing to come into a space where you may be the minority? I want to invite you out to Emmanuel Baptist Church in January. We have the Martin Luther King program. In February, we have the Black History program. In June, we have Juneteenth right down at Jackson Taylor Park. Come into our spaces. And I want to let you know that I'm doing the same thing. Every single Sunday, I am going out to preach. And I am going to predominantly white spaces where people, they don't even have to come into contact with people of color if they don't want to. But here I am walking into that space, willing to engage, willing to share of myself, willing to develop relationships with people who may not think like me or even have experienced life in the way that I have. So I would invite you to come into our spaces and to be intentional about engaging with people other than yourself, people that are not like you. I think so much of the time we're in an echo chamber where we're in spaces that people are just reinforcing things that we already believe, and we're not willing to see the perspective of the other. So I would encourage you, listen to things that you know you're not going to agree with. Listen to podcasts that you know you are opposed to already, but see if in listening you find something that you can agree with. Because so much of the time, that's what I'm looking for. I'm looking for the one thing that we can come together and agree on. I'm looking for the good. I'm looking for the thing that we can work together on. There's always something. And that's why I think that Jamestown and Chautauqua County is so special, because we're doing that more and more, willing to engage with people that are not like us. So God continue to bless this community as we move forward.
Thank you. Terry, let's go to you next. Again, challenge. How can folks learn more about the issues and challenges facing those dealing with generational poverty, and how can they assist you in those efforts?
So I think one thing that people can do is really take a look at themselves and look at their own biases. We all have them, and recognize that, and, and not say, oh, I don't have any, and recognize that, and really try to get to understand why people are in poverty. I think we talked about some of the things today that hopefully people didn't realize, right? That, there are situations and circumstances that, that lead people, and put them in poverty, and not to assume why they're there or, why they continue to be there and think that it's just an easy thing and you can just go get a job, right? The other thing is there's a program that was started this past year, and it's funded by the United Way of Southern Chautauqua County. It's called InvestU. And InvestU follows a curriculum that's called Getting Ahead in a Just Getting By World, and it's modeled after Bridges Out of Poverty. It's a series of workshops that people in poverty come to. It's 16 weeks, and they are called investigators, and they investigate not only themselves and their lives, and they kind of look at where they've been, where they're at, and where they want to go, but they also investigate their community. And we had our first class and we had our first graduation back in July, and we invited a lot of community members to come to the graduation and see the graduates, the work that they put into the workshop and what they learned about the community. And they have such a wealth of knowledge about the barriers in our community and what puts people in poverty and what keeps them in poverty. And they did a whole activity on, really why people think someone's in poverty and really why they're in poverty. And it was really impactful for people that were there at the graduation to see and hear what they had to say and the research that they did over the 16 weeks of really investigating themselves and the community. And I would invite people to, follow up and find out when the next graduation is and come and listen to that and hear what people have to say, because they really have truly, truly amazing stories on their life and their situations that might make people think a little bit differently before, really putting that bias on somebody and understanding them. So I would say really learn more and continue to learn more about some of those barriers that we talked about, the benefits cliff and some of those policy things, so that people can come together and advocate for change that needs to occur.
Thank you. And last but not least, we're going to go to you, Sean.
I would say, I can echo what pretty much every person has said is about the education. Educate yourself on the substances, educate yourself on mental health issues, substance abuse, substance use, educate yourself on harm reduction, all these different things. But also, if you don't have the time to educate yourself, reach out to us. Reach out to the peers at the MHA. We are more than happy to sit down and talk to someone and explain things to them and help them to understand what's happening. And the other thing, too, is honestly, I think that the greater community needs to be honest with themselves. People that use substances are in every single family, period. They are. It's, the uncle we don't talk about. Well, guess what? How about talk to him? Try to help him. See what's going on with the uncle. Reach out to him. See what issues he's dealing with that are making him do things that are a little chaotic in his life. Maybe you can help him. The same with the person you see walking down the street. Don't stigmatize them as one of these cliche words of someone who uses substances. Understand that that is someone's brother, sister, mother, father, grandfather. It's a human being that is going through a rough time. And instead of shunning them and telling them to get it together and grow up or whatever it is, try to help them out. Or if you can't help them out, reach out to someone who can. It's, like I said, substance use and abuse affects everyone, one way or another, but because it is not cancer and not this or not that, they shun it because, we don't talk about those things. They need to be talked about. They need to be discussed because they're there. It's everywhere, and the more we talk about it, the more we understand it. the more we become comfortable with it and the more we can help people in all communities.
I know that Heather has another question she can bring forward, but while she is doing that, the question from our audience here in studio is, I think, I think there might be a couple people who can answer this. It might not be everybody. It's specifically about language, so Millie, get ready. But one of the question was, how did you get to help students or anyone in your community who do not speak the English language, whether it's understanding COVID-19 information or just anything?
How did I get?
Well, I think it's kind of this is like one of those two-parter things. So I know you're a teacher, so but I think for the others, if you're thinking about people you work with or people you engage with, and someone who doesn't speak English, whether it's they speak Spanish, they speak any other language, how are you? Do you know how they're getting help in getting, with translations? And so the obvious is to start, Millie, with you.
How did I get to learn?
I think it's a general, I think it's how do people in your community, if they need that translation, how are they dealing with this right now?
I get, like I said, they're bringing, it's age old too, all immigrants, they're bringing their children with them. Their children are becoming many adults with serious issues so that they can, get services. And that's all I guess I can speak to in that regard. And my, I guess, involvement has just come from my desire to help the community, but then feel like most of my years trying to reach out, nobody's tapped in, and I don't know why. I don't know why. If I can do it, why can't I help? But then I answer my own question. I am one person, and we need to be teaching. We need to have leadership amongst the Latinos, because it's not just a one-way thing. You have to master both languages, and I'm not saying perfect, but you have to have that ability and articulate. And there just has to be, time has to be made. We can see that we can work from home with the Zoom. We can do many things, but people have told us otherwise. We just have to, I guess, decipher and problem solve a lot more. And it's difficult. I don't know that did I answer that? I'm having a terrible headache, so I apologize. So,
right. No, I think you did answer that. So
okay.
I'll assure you that. Reverend Charlotte, in the AfricanAmerican community, I imagine not everybody speaks English as their first language. I don't know if you've come across where you've had someone come into the community or is existing where they have some sort of that language barrier. Do you see offered to them, or how are they helped if they are?
My thought process is like the school system is a place where they do very well with that. In other words, all the paperwork they have is in English and Spanish. All the announcements are in English and Spanish. But I was at a focus group for the YWCA, and there was a large number of Hispanics, and that was one of the concerns that they did have, that many times there wasn't a person to translate in different spaces, or communications were not in Spanish, so there was that barrier. And just on a more personal note, Brenda Stewart does the Princess Club, and she has all girls, and there was the language barrier, and she literally had to go out and get a Hispanic neighbor so that there could be. So that is definitely an issue and something that we need to be working on, that whatever service is needed, it needs to be in English and in Spanish. There needs to be signage in English and Spanish, paperwork in English and Spanish, and communication. There should always be a Spanish person available.
But the forms that you're talking about, it's not just the translation to the language. It's so complex. Everything's been made to be so policy that people who don't have an education, that are the parents who then have to make the decisions, they don't know what they're deciding. So then what? And then and before you know it, that half hour, and it's a valuable time, it's gone, and maybe nothing was accomplished. So.
Can I maybe jump in and see if we can expand this question to be a little bit broader? So I'm also thinking of people with disabilities, folks who might use American Sign Language. Have either of your agents or any of the other agencies try to work with communities or with individuals who need just a different way to communicate?
Well, I can say right off the bat, so our Spanish-speaking population, we, and God rest his soul, we had a beautiful man that worked for us at the MHA, Luis Rosa, and he was amazing in the way that he helped the Latino community to be able to communicate with the doctors. And with, outpatient in these different places, especially because, and I'll never forget this when Lewis talked to me about this, the phone system that they use, the doctors and the therapists in a lot of these places, it speaks a different dialect, he said, than a lot of the Puerto Rican community here. Yeah. And so he would sit there with them, and they would be trying to translate it over the phone, and the participant would be ready to say, they would look really confused, and then Lewis would actually have to translate the Spanish from the phone to the participant, because the two different dialects, what was happening was people were saying yes to things or no to things, and they should have been saying the opposite, like I said, Lewis was just an amazing man and a huge loss to our community here in town. And we are working to get someone else to work with us. I can't say to replace him because that's literally impossible. But we are striving towards that to try to help them. And that's, because of Lewis teaching me the things that he taught me, I do explain that to counselors. Please be careful. Make sure that they really understand what the translator is saying. Because if they don't, I would stop that meeting right there and find someone else to come in and help so that they don't answer wrongly to a question and then jeopardize themselves in their treatment and anything it benefits, so.
And may I also interject quickly that is why Community Helping Hands has become such a hub for the Hispanic community, because there is Serena, who does workforce development now and does it so effectively and creates a sense of community, and people are able to communicate with one another and get to learn English more. But that is so important, and that's part of the success of Community Helping Hands and helping to uplift the Hispanic community, because they have that level of effective communication there.
I would also add that, you mentioned sign language, and over the years I've supported a lot of people that were deaf and made my best attempts at learning sign language, and not fluent, but was able to communicate effectively for the purpose of the conversations that I needed to have to support people. But we also have a lot of people who just don't communicate with words. And it's really about getting to know the person and trying to know the person and know how to respond to them. So if they're not going to be communicating with spoken words, really making sure that anybody that's going to be supporting them really knows how to read them, because you're going to come a lot of contact with people that are not going to, it's not about speaking English or Spanish. There's a lot of other things. And so making sure you really get to know the person so that you're understanding their wants and their needs. And I think we've done a really good job over the years trying to learn what works for people, and whether it's finding communication devices, or there's so much technology now that can help with any language. I know we've utilized that a lot of times if we don't have an interpreter for somebody that speaks Spanish or sign language, or to be able to find some technology that helps. But certainly dialect comes into play, and there's often things can be misconstrued. I think of a time several years ago when I was supporting somebody, and we were at a church service, and the pastor's wife was trying to ask somebody a question who was deaf, and from across the room, I could see what she was asking. She meant to ask him, a question about his employment, and it was definitely not what she asked, and it was like a train wreck. I couldn't stop her, and the person was just laughing because he knew what she was asking was inappropriate and not what she was attempting to ask, and I just went over and I said, let me help you rephrase the question. And she's like, well, what did I say? I go, oh, I'm not telling you. But,
we are live on the air,
yeah.
So thank you for not telling me.
Yes, things can very easily be, misinterpreted and misunderstood. So it's really important to know your audience and know what you're trying to get across. So trying to really know people and helping them communicate.
Can I add one more thing?
Yes.
Do you have time?
Yes.
What Shiloh had said before about being intentional, this is years ago now, but I had, there were three of them, a husband and wife, and another man who they were on the volunteer firefighting. And I don't know if I shared this when you were with the Spanglish, but they came to me and they wanted to learn Spanish, and I said, well, I can try to throw something together. It wasn't my forte at the time. I hadn't become a teacher. And they said, well, every 3 years we have to prepare for something that would be catastrophic. And they were talking about the airport here and how at the time the baseball teams that would come from Puerto Rico, God forbid something happened, how would we help them? And they wanted to be able to speak in Spanish. And I thought, oh my gosh, they were being so intentional to try to learn. And I said, but let me ask you something. I mean, if something really happened, and you couldn't speak, what happens? And they're like, well, we use the protocol and whatever the symptoms are, and we have to address that. And because if they're nonverbal because of what happened to them, we have to take care of them. And I said, that's awesome that you wanted to do this. But going back to the technology that you're talking about, I had a good friend. She's since retired from the hospital, and she was constantly called to translate. And then with technology, the phone systems, they would, use the phones. And just like you were saying, Sean, too. And it's like, how did we remove the emotion and the humanity? Because we don't want to pay for someone and put value into someone, anyways. Could go on and on. So, yeah.
There are those apps that certainly can maybe, if you're traveling, help you figure out where the bathroom is, but it cannot substitute. And I know this because I speak 4 languages. English is my 4th language, so I've seen some of the Google translations, and I'm like, oh no.
Yeah, exactly.
Oh no.
Yeah, yeah.
And it's interesting because you mentioned the Spanglish class, and this is how I know Millie. I did before COVID, and everything in life happened.
Yes.
You had a wonderful class that you were offering just for anybody who wanted to come to learn how to speak Spanish again, or at all. And I thought, well, this is my opportunity to remember what I've forgotten from all my Spanish. And I think people who are English speakers as their first language, they do not appreciate how difficult the tasks we're asking those who are non-native speaker, non-English speakers to take on. We're asking you to become bilingual and with a snap. And how many other of us can speak more than one language?
And that makes me feel like thinking about those from Afghanistan coming now. That they can't speak or what they went through. And in a heartbeat, if my small, humble shoebox of a home would serve, I would take them in any time. And I don't know how I would communicate, but again, it's the humanity, bringing it back and not fearing the other. Approaching people and saying, hey, how can we do this? Tap into the strengths. So you mentioned Sabrina. I don't think I've ever met her, and that's great to hear because I feel like my place in whatever this is, maybe it's when I'm going to be 80 years old. I remember a lady who was at, oh my gosh, now I'm thinking, I can't think of her name. Lydell, Mrs. Lydell. Anybody remember the name Lydell? Norm Lydell, his mother, and she worked with the JNP. And that was, I think, where Sabrina is now. And she was 80 years old teaching Spanish to people who wanted to learn. And I'm like, well, maybe I'll be 80 and I'll be doing it again. But, my time now is with my family, and that's, and surviving. And yeah, I miss doing that. And it was nice to see people coming forth because they wanted to learn. So.
We do have a question that came from online, so we do want to ask that, and this is a longer, so I'll go through it first. So the question was, there are some in our community who say today's marginalized groups no longer face challenges, that racism doesn't exist, those living in poverty or dealing with substance abuse do it to themselves, etc. And this is evident when it comes to teaching critical race theory or celebrating Pride Day or suggesting there needs to be more Spanish language services or better assistance for people battling addiction. This is especially true on social media. How should we deal with those detractors? Should we ignore them? Or do we continue the effort to educate them? And I think we'll start with Michaela first. I think, speaking for the queer community, how do we deal with the trolls? How would you say?
I mean, haters gonna hate, but at the same time, we are explaining of what we're doing. We're explaining how Black lives do matter. We're explaining how LGBTQ lives matter. We're explaining how Latinas and Latinos matter, Hispanic, everything. We are educating people that doesn't understand what's going on, and y'all are literally just moving along and not caring and saying all these negative things to think that we don't care for. Like, it's hurtful to us, yes. Because we're trying our best, because there's so many people that's in that community that think that nobody cares for them, if they're Black, gay, or homeless, or just dealing with drug abuse, anything like that. And we're trying to educate them, give them support, and trolls be saying stuff. Honestly, I ignore them. But they need to understand that change is a good thing. We are changing for the better, and people need to know that it's not always going to be the same. It's not always going to be the same little 1800s that doesn't care for the gays, doesn't care for the Black people, or separate from different races, stereotyping everything. No, we need change. We need to change everything because it's not always going to be the same. So they need to realize that and suck it up. We are not little kids that can just tell things and bully people for the way they are. You need to accept that they are who they are, and you're going to deal with it no matter what. That's all I'm saying.
Rev Charlotte, if you follow along with that, we do hear people say racism it doesn't exist, and we do see many things said online. And so, how do we address that when we see it? Do we address it?
I do think that that's been the most challenging part for me. To know that people that I've partnered with literally for decades look me in the face and say, there is no structural racism, there's no institutional racism, that does not exist. It's been very hurtful, but I still make the choice to engage with them. I still make the choice to partner with them, hoping that they do see the light. But what I am finding is different allies, and ones that I did not expect to have, going into spaces that I did not expect to go into, because the people that I thought were for me and that would fight with me for more inclusiveness, more diversity, more equity in every sector, those are not the people that are coming alongside me. So although it's been hurtful, I still engage with them. They're still my friends, but we're gonna just have to agree to disagree about some things, and I will partner with those who are going to fight for inclusion, who are going to fight for equity, and who are going to fight for our country to include everybody as we move forward.
Millie, I want to stay on this side just because I look at 3 women here who are coming out as leaders of the community, and we so often lean on women in your communities to show us the way. And I think that's very difficult. I'm very glad to have you, the 3 of you, here today. And I'm so thankful. I don't know how much you're online, Millie, but if you see these things, people saying hateful things, saying things that are wrong, uneducated, how do you think that they should be dealt with?
First of all, I'm disgusted by it when it happens. But I also think that that's one thing, if I stay away because I don't want to feel that and I want to be positive, then I feel like I slip away and I can't be effective for change. So, of course, I feel bad about it. I'm disgusted by that individual, but it reflects on them. And I would say, yes, we have to continue educating. We have to. There's no other way. And we have to continue the fight. How do we deal with them? I really don't know. I mean, the small relief I felt with the different silencing of certain groups and leaders that were shut down, I think that's the way, but I feel like it's just so vast. How? And then I think about like the students that I teach. I'm in a rural area, and the boys especially, with the video games. Oh, well, I was really, really upset the other day and it really didn't hit me. I didn't process it, and I guess I'm processing it now. They said that they talk with other kids in Spanish. I'm like, oh, wow, that's awesome. They're making connections. No, they said to the other person, they told them how he could die with the violence on that video game with the headsets and their technology to look up how to say whatever. And it's kind of like the bullying and suicide and all that, you know, and I'm like, I don't know. I don't have answers. It's just so there. And I heard a radio program on NPR today, and I believe that they were talking about what is the youngest age that children are having the cell phones, and I think the average now is 10 years old, and that most of the young people, their parents are too busy or don't have the tech ability to have the parental controls. And what do you do? And the exposure to everything at that young age, I don't know. And these people are just hateful. And to go back to another aspect that I've been a part of is, let's see here, be diplomatic. How do I say this? I became involved with politics, but again, for the people, for what the people need. And I was part of the protests before I met you, Shalot. I mean, this is going back probably to 2014, maybe 15, I think, upon 2016, and the BLM movement. And the majority of us in the beginning at, is it Dow Park? Is across from the library, right? Majority of us were, I want to say, late 60s and older. And then there was me. I want to say a couple of 30-year-olds, my youngest daughter, 19, and a nephew. And the people that were hating were white, were men, men with beards, men with diesel trucks, men with fingers sticking up, and F words out of their mouths, and coming at us with such violent movement in those trucks on the street that one wrong movement and they would have plowed through who was there. So I don't know. It sometimes feels so overwhelming that I just don't want to, you know, I say that I'm on Facebook, or I guess that's it really, but just because my family's in Puerto Rico, but honestly, it's just we get little blips of, oh, it's this person's birthday, or this person did this, and then whatever the algorithm is, or I don't even know. And it's so overwhelming. I don't have an answer. Does anybody have an answer? Do you think you have an answer?
I don't know. I'm speechless right there with you. Like, it is so hard. Like, every year when it comes to, like, Black communities, always be somebody with, like, police brutality that passed away about something. And it's hard seeing that on the news, Facebook, any social media platform. And I went to a protest, and I fight for what is right. And it's hard seeing that all the time, because we are showing like people like our lives do matter. And you need to realize that these are grown people, okay? They are grown. They passed puberty, whatever it may be. And it's just like, they still do this little kiddish things and say hateful comments to make people mad. It's like, it's so gaslighting. It's so hurtful. Like, you are literally grown and you're doing this to people like that. It's disgusting to me, man. And we try to ignore it and we try to find the good things, but if you can't,
On a lighter note, to think more positive, I reached out with intention myself to a young man named Jose Sanchez, and he had been trying to put on the car show, Los Contrincantes Car Club, and I first was reading about it through the summer. I went to visit my grandson in Texas. That was laborious to travel down to Texas and time consuming, and I loved every bit of it, but every once in a while I'd read the newspaper up here and I was like, oh, what's going on with this? What's going on with this? And I'm like, why is this taking so long? And then different comments I would read amongst educated groups that I'm part of, safe communities that I'm part of. I said, wow, I mean, blatant racism, move the goalposts is what someone said. And so when I heard that he could put on the show, I am just so sad that I missed it. I heard it was just fabulous. So I called him and we had some, conversation. He's like, my family's been here since like they were one of the first families. I said, no. My father was our family was the first family. What is your last name? Rodriguez. I said, no way. I said, that's my godfather's last name, Rodriguez. But then my father's last name is Torres. And then everybody's like, oh, are you related to so-and-so? And then, oh my gosh, if there's something bad in the newspaper and it's a Torres, were you related to them? No, it's kind of like Smith and Johnson and Anderson. No, But, and then what Justin said last week also, and I don't want to steal your thunder, but moving forward, I want celebration.
Yes.
I want reward for our hard work and what we go through. And your hard work, oh my gosh.
About that, and maybe that will be the one that we will close with, but want to at least give you an opportunity to respond to that question of how do we deal with folks who are just don't believe that these problems exist or believe that they're on their own making, right? So you're responsible for the consequences kind of line of thinking.
Yeah, I think, social media is such a hard place. There's so many opportunities there. And I think, if people could stick, as hard as it is to read things sometimes and try to stay positive with what they're hearing, I think the best way to do it is to speak with data and speak with intention and not let the heat of what you read impact your response, right? So that you're not buying into it, because that's what somebody was looking for in the first place. So, if you can educate people by sharing information and resources and give them information where they could go learn more about it, maybe provide a link instead of, some choice words, or give them some quotes or some statistics that will help educate them versus having that, what would be our natural gut reaction would be to, perhaps take it down a path that wouldn't probably get us anywhere as a community.
I think the thing that I keep thinking about is, because we all know how the negative comments are out there and how horrible they are and how hateful they are. But if we're going to talk about something honestly that's positive that is coming from all of that negativity, is the youth. The youth is becoming so much stronger than they even were when I was a child, and I think any of us were a child. They are standing up for themselves more. They are fighting back more. They are pushing back more. And honestly, I think it's our responsibility as the people in our 40s and 50s to really help support them and make sure that they have all the support that they need and they have the backup that they need. Because I think, honestly, in my opinion, I think the reason why these comments that we see are so hateful is because and you all spoke on this, those people are becoming the minority. And they're trying to fight back, and they know that they are losing. They know that the younger generation is pushing them away. They know that we are becoming more inclusive. They know that we are starting to love one another, care for one another, respect one another more and more as time goes on. And I just keep thinking about that. Like I have 2 young sons myself, and I try to, teach them to be responsible, not just as young men, but also socially, and I think that's the type of thing that is just really going to hopefully push the people that I can't say the word over the edge, and then they just go away. Even though we know they're always going to be there.
Yeah.
We know they're always going to be there. But let's make them the silent ones instead of us.
Make them
right?
feel uncomfortable.
Let our voices continue to be loud, continue to be strong, and to continue to push on together.
Yeah.
So I want to take moderator's privilege just to chime in on this question a little bit. I really echo, I think on social media is not the place to change hearts and minds.
Yeah.
So I don't engage there because nobody's changed my mind there, and I haven't been able to be successful there. But fundamentally, on a spiritual level, I do think racism or hating any group is a spiritual sickness, right? Or at least in my mind. So there is a place for the faith community and the leaders of the faith, every faith community, to take on these issues and really deal with that. What is it that is not enabling people to see the humanity, to hear the stories, to understand that? Now, if the story is on a movie or a TV and a book, it is something a little bit more intellectual, but we cannot fully understand people we don't know. Yeah. So for me, it's like how are we working in inclusive workplaces? Who's coming to your dinner table? Whose table are you going to dinner for? Is what can help some, not all, right? Some people may never change. If hate is learned, it can also be unlearned and replaced with love. So I try to stay optimistic, to stay sane in the work that we do. What do you think? Do we have time or do we save this for next panel?
I really want it because it's such a positive note to end on. If you think you can keep your comments to 30 seconds, it was a question from the audience about the need to celebrate and acknowledge the groups you represent, and what facets of your group would you like to see acknowledged or celebrated? Like I said, this is very fast. I'm going to go from my left to right. So Terry, if you can, what's something that you would like to see celebrated for those dealing with generational poverty?
I think celebrating the successes, right? So when someone gets a job, someone's moving up that ladder and out of their current situations, having people recognize that and celebrate it, and really continue to provide support to them so that they can continue on that progression.
Thank you. Sean?
I would say celebrate. The thing to celebrate within the substance use community is just celebrate who we are. Celebrate who we are. We are all people. We come from all walks of life, and we are extremely strong, resilient people who don't give up, and we continue to keep pushing. And I mean, to kind of go with what we were just talking about too, we are inclusive. I mean, we call each other brother and sister in meetings, no matter who they are. If you're sitting in a meeting with me, you are my brother, you are my sister, because we're in that together. So I mean, just learn to celebrate all the people within the substance use and mental health community.
Thank you.
For who they are.
Millie, how would you like to see the Hispanic community?
I want a huge cultural celebration. First, though, I think we have to plan it really well. I want to definitely reward and make people feel like we're all one, we're all for each other. So it has to have music, lots of food, dancing. We need to have lots of stuff for the kids, and it needs to be super colorful. And there are 2 times that I always celebrate myself in my classroom, because it's not as widely accepted, but they allow us to hang the flags, like Max was talking last week, very positive. Have those flags for Hispanic Heritage Month the whole month on the bridges, other places, kind of like a mini United Nations right here in Jamestown, New York, and then celebrate Foreign Language Week. It is Foreign Language Week. New York is going to change foreign language to world language, so it's more accepting instead of saying it's foreign, and again, celebrate at that time of the year, which is in March. So September to October, and in March, and then over the summer here locally where we have good weather. So lots of party. Yes.
Michaela, how would you like to see the LGBTQ plus community celebrated and acknowledged?
What I need is like a gay straight alliance community to come here. I feel like if we come together to do that, that would be awesome. All of us coming straight, gay, bi, lesbian, pan, to celebrate that and bring a lot of unicorn colors and stuff, and just see I am gay, and then tell them about our pronouns, our coming out story, how do we identify ourselves and who we love. And I feel like if we do that, that would be an amazing celebration. Don't forget about the unicorns.
Reverend Charlotte, how would you like to see the African American community celebrated and acknowledged?
Yeah, I would love to see the children who successfully navigate high school and go to college or get a trade or internship, something like that. Let's celebrate them. Navigating school is a minefield for our students. And also the elders, those who have gone before us to prepare the way, those who have taught us, those who have given us a sense of community and a sense of pride and integrity in who we are. I would love to see them celebrated in a magnificent way, because they are who I am today.
I'd like to thank everybody for being here tonight on our panel here. Thank you everyone who is watching either here in person or online. Our final conversation in this series will take place next week, Thursday, October 7th at 6 p.m., where we will discuss the future and possible actions that can be taken here in Jamestown. Thank you again. You'll be able to watch this presentation on our Facebook page, on our YouTube channel, and on WRFA LP. On behalf of Amit, Jason, and all of the WRFA team and Reg Lene Center for the Arts, thank you for being with us. We look forward to seeing you again next week. And again, you're listening to 107.9 FM WRFA LP in Jamestown, New York.